Today's vlog is going to be focusing on innovation and the importance of innovation to healthcare. And with me I've got Dr. Kathryn Todd, who's our Vice President for Research, Innovation, Analytics. And she's one of our co-sponsors for Strategic Clinical Networks. So I wanted to spend some time with her today to just provide the latest update on SCNs.
Right now we have 14, soon to be 15. Our newest one will be around primary care, an integrated primary care network of people in order to help us shift our efforts to ensure that people get the proper care in the community and the proper care in the acute care setting. We like to think of the SCNs as the engines of innovation for Alberta Health Services. We like to think that what they provide for all of us who are Alberta Health Services is an opportunity to gain knowledge, to look at evidence, to consider in a robust way, are we doing things the right way? Could we improve? Should we improve? How would we improve? And how would we implement enhanced, better ways of doing things around the delivery of care for Albertans?
Maybe share with me some of the outcomes and the benefits that SCNs have brought to AHS.
I can focus on one around the use of antipsychotics for seniors in our long-term care centres. When they looked at this robustly and provided a toolkit for where the front-line providers could really examine the appropriate dosing of antipsychotics, and if antipsychotics would even be needed, they found that in many cases it wasn't needed, or you could significantly reduce the dose. And that improved the quality of life of these folks that are in these care centres. It actually improved the relationship between their family and their care providers. And it reduced the burden on care providers for maintenance of hygiene, helping to feed them, because now many of these patients could take care of their own hygiene.
I still remember a quote from, I think, a couple the husband, the wife was in the long-term care facility, and when she was taken off the antipsychotic medications, I think his quote was, thank you for giving me back my life.
Yeah.
I mean, that for me was just
it was amazing. Yeah, it was great.
So what's the future for SCNs right now? What's going to be coming for 17-18?
What's coming for 17-18? Well, you probably know we recently launched a digestive health SCN, which is going to have huge, I think, really great impacts on the way we deliver care around digestive health. It's going to look for a lot of best practices, standards of care across the province, stop doing things that we shouldn't be doing. When we do that, we can reallocate funds across the organization into things we should be doing better. Remember, innovation is not just a widget or a digit, it's a way of doing things better. You know, what's interesting is when we first were looking at SCNs, we kind of said, here's the need in a health sector, here's the need. And now what we're saying is people are forming networks on their own and saying, here's what we can deliver to the health system. Will you call us an SCN? For me, that's a huge win.
I would agree with you. And just want to thank you and thank everyone that's been involved in SCNs, and we'll look forward to the next vlog. So thank you for joining us today, and we'll talk again soon.